This is Heliox, where evidence meets empathy. Independent, moderated, timely, deep, gentle, clinical, global, and community conversations about things that matter. Breathe easy. We go deep and lightly surface the big ideas. All right, let's jump into some pretty interesting research, huh? Ready for a deep dive?
Always.
Today, we're going to be looking at sugary drinks and their impact all over the world, really on global health. And we're going to be using a research article from Tufts University, and it was published in Nature Medicine.
Great source.
Yeah. So our main goal today is to kind of get a grasp of how big this issue is. We want to pinpoint the regions that are facing the biggest challenges. And we also want to look at what are some of the potential solutions that are being explored right now. And just to give you an idea of what we're dealing with, we're going to start with a pretty wild stat. In Colombia, almost half of all new diabetes cases are linked to sugary drinks.
That's a powerful way to start. It really is incredible how these drinks, they're not just empty calories, they actually directly contribute to some of the biggest health problems that we see worldwide, like type 2 diabetes and cardiovascular disease.
Yeah, and the numbers that the study shows are, they're pretty alarming. Globally, we're looking at 2.2 million new cases of type 2 diabetes each year.
Wow.
And then another 1.2 million new cases of cardiovascular disease each year. And all of these are attributed to sugary drinks.
It's a huge number.
Yeah, it's hard to even imagine. Think about it this way. That's like the entire population of Chicago being diagnosed with diabetes every single year just because of sugary drinks.
It really puts it in perspective.
Right.
And what's even more concerning is that this isn't just happening everywhere equally, it's really hitting developing countries much harder.
Right.
So sub-Saharan Africa, they're seeing something like 21% of new diabetes cases linked to sugary drinks.
Wow.
And then in Latin America and the Caribbean, it's even higher, like almost 24% for diabetes and over 11% for cardiovascular disease.
And this study, it really zeroes in on Colombia, Mexico, and South Africa as being particularly affected by this. It's wild. Like you said, almost half of all new diabetes cases in Colombia are connected to sugary drinks. What's going on in these regions that's contributing to these really, really high numbers?
It's complicated. There's a lot of factors at play. But as these countries are, kind of going through economic development, their incomes are rising.
Right.
Sugary drinks, unfortunately, they become more readily available. Plus, they're often marketed really aggressively.
Yeah.
So it's like progress, but it has this downside.
Yeah, like a hidden cost almost.
Exactly. And what happens is often the healthcare systems in these regions, they just haven't caught up with these rapid changes. Right. They're not really equipped to handle this huge increase in chronic diseases that comes from, more people drinking these sugary drinks.
So it's like we have easy access, persuasive marketing, and then limited resources to deal with the consequences.
It's a perfect storm.
Yeah. But before we go too deep into how complex this issue is, maybe we should take a step back and just break down the science behind why these drinks are so bad for our health.
Okay, so imagine pouring sugar right into your bloodstream.
Oh, wow.
That's kind of what happens when you drink a sugary drink. They're digested really fast. They have no real nutritional value, and that leads to a sudden spike in your blood sugar.
So it's like a quick burst of energy, but nothing really beneficial.
Right. You got it. But over time, all these blood sugar spikes, and the fact that there are no good nutrients in these drinks, well, that leads to weight gain. It makes your body less responsive to insulin.
Oh, wow.
And that triggers a whole bunch of metabolic problems. And guess what? Those problems are basically the foundation for serious conditions like type 2 diabetes and heart disease.
So it's not just the immediate effects, it's like this slow burn, this damage happening over time.
Yeah, exactly. And there's another interesting finding from this study. Men seem to be more affected than women, and younger adults are more at risk than older adults.
Why is that?
That's what researchers are trying to figure out.
Yeah.
It could be biology, it could be differences in what men and women eat and their lifestyles, or even cultural influences. It's a puzzle.
Definitely a puzzle. But one thing's for sure, we need to do something. This study is making it clear that we need to intervene.
Absolutely.
And thankfully, it also points to some potential solutions. So let's shift gears a bit and talk about what those might be.
But the study really stresses that we need a multi-pronged approach here.
Okay.
So we need to combine things like public awareness campaigns with actual policy interventions.
Mm.
Things like regulations on advertising for these sugary drinks, especially when they're targeting young people or vulnerable communities.
Right, yeah. We need to protect those who are most at risk, for sure. But how do we make sure that these public health campaigns are actually reaching the right people?
That's the million-dollar question, isn't it?
Yeah.
Implementation is key here. We can't just create campaigns and hope for the best. We got to be strategic about how we get those messages out there, through channels that people can access
Yeah.
that are relevant to the community,
Mm.
maybe working with community leaders,
Mm-hmm.
using mobile technology,
Yeah.
or even partnering with organizations that are already working in those communities.
Yeah, and the study also mentions taxes on sugary drinks as a way to nudge people towards healthier options.
Right. And we actually have some real-world examples of this working.
Oh, yeah.
Yeah, like Mexico,
Oh, yeah.
they put a sugar tax in place back in 2014, and the early data is showing that people are actually drinking less soda, especially in lower income groups.
That's amazing. That's a really positive sign for sure. But there are some people who say that taxing sugary drinks is unfair to those who are struggling financially, that it hits the poorest communities hardest.
I get that.
Yeah.
It's a valid concern, absolutely.
Right.
But if you look at what happened in Mexico, the tax actually ended up reducing consumption more in those lower income groups.
Hmm.
So it might actually benefit them more in the long run.
Yeah.
Plus, the money from the tax can be used to fund health initiatives in those communities.
Right. Right.
That's simple. There's pros and cons to weigh.
Absolutely. So it's we got to weigh the economic impact against the long-term health benefits. But I'm curious, besides regulations and taxes, were there any other solutions that jumped out at you from the study?
One thing that really resonated with me was the emphasis on education.
Oh.
We need to empower people, especially young people, with a clear understanding of what excessive sugary drink consumption can do to their health in the long term.
Right.
Knowledge is power, right? It's
Yeah.
the first step towards making better choices.
Yeah, I agree. But do you think education is enough on its own? I mean, we're up against some pretty powerful forces here. These companies are spending millions of dollars to convince us to buy their products.
That's a great point.
Yeah.
We can't ignore the influence of the food and beverage industry. Education is important, but it has to be paired with changes in policy that can even the playing field.
Yeah.
Things like regulating advertising, especially to kids, and making sure labels are clear and easy to understand.
Hmm.
We got to make it easier for people to make the healthy choice.
So it's about empowering individuals
Yep.
and at the same time creating a supportive environment where those healthy choices are available to everyone.
You got it. We need to understand that personal choices aren't made in a vacuum.
Right.
They're influenced by social norms, by economic factors, by access to information.
Absolutely.
We need a holistic approach that addresses all of those things if we want to see real change.
It's fascinating how interconnected this issue is.
Yeah.
It might be hitting developing nations harder right now, but it's a challenge for all of us.
For sure, it's a global issue that demands a global response.
Right.
We need to work together, share what we know, pool resources, learn from each other's successes and failures.
And there are organizations out there already doing that, right? Like the World Health Organization and other international groups.
Absolutely, they're playing a critical role in bringing people together and encouraging global collaboration.
It really makes you think about the bigger picture. We're not just talking about drinking less soda.
Right.
It's about creating a healthier, more sustainable food system for everyone.
Absolutely. And that means changing the system, not just blaming individuals.
Yeah.
We need to address the root causes, the social and economic and environmental factors that drive unhealthy eating habits.
So as we wrap up this deep dive, what's the one thing you want our listeners to remember?
I think the key takeaway is this. The impact of sugary drinks on global health is a complex problem with many layers, but it's not hopeless. We know what we need to do, and we have the power to do it. It starts with awareness, then education, and finally, action.
And that action can take many forms, right?
Yeah, absolutely.
It can be swapping that soda for a glass of water, speaking up for policy changes, or even just starting a conversation about this with your friends and family.
Every little bit helps. We can all be part of the solution.
It's a powerful message. We're not powerless against this. Each of us can contribute to creating a world where healthy choices are available to everyone.
Exactly. We have the power to shape a healthier future, one sip at a time.
This deep dive has given me a lot to think about, and I hope it has for our listeners as well.
Me too.
We've uncovered some pretty shocking facts about the impact of sugary drinks. We've explored the science behind why they're so harmful, and we've even talked about potential solutions. It really makes you realize that we're all connected when it comes to these global health issues.
Yeah, for sure. What happens in one part of the world, it affects everyone else.
Right, exactly. And that kind of brings us back to the solutions. We've
Yeah.
talked about policies, public awareness, individual choices. But there was something else in the study that really stood out to me, the focus on collaboration,
Hmm.
like
Yeah.
sharing what works across borders, not just having each country try to tackle this on their own.
Right. We need a global response to this global problem.
Exactly. So like sharing knowledge, best practices, that kind of thing.
Absolutely. We need to be sharing data, learning from each other, both the successes and the failures. And
Mhm.
organizations like the World Health Organization,
Yeah.
they're crucial for making this kind of global collaboration happen.
It makes you think about like the bigger picture, right?
Yeah.
We're not just talking about cutting back on soda. We're talking about building a healthier food system for everyone.
Absolutely. And that requires a systemic approach.
Right.
We can't just focus on individual behavior. We have to address the social, the economic, the environmental factors that shape those choices.
So as we wrap up, what's the main message you want our listeners to take away from this deep dive?
I think it's this.
Mm-hmm.
The issue of sugary drinks and global health is a big one. It's complicated, but it's not hopeless.
Right.
We have the knowledge, we have the tools, and we have the power to make a difference together.
Hmm.
It all starts with awareness, then it grows with education, and it ultimately leads to action.
And that action, it can look like a lot of different things, right?
Oh, yeah, for sure.
It could be choosing water over soda. It could be speaking out for policy changes, or even just having a conversation about this with the people you care about.
Exactly. Every step matters, no matter how small.
It's a powerful reminder that we're not powerless in the face of this challenge.
Yeah.
Each one of us can play a role in creating a world where healthy choices are available to everyone.
That's what it's all about. We have the power to build a healthier future, one step at a time.
Well, this deep dive has been incredibly insightful. It's been a little sobering to learn about the impact of sugary drinks.
Yeah,
But it's also been inspiring to hear about the solutions and the potential for change.
absolutely.
We've uncovered some pretty startling facts. We've looked at the science behind the problem, and we've explored some potential solutions.
That's been a great discussion.
But now it's up to each of us to take action. What will you do? Will you swap that soda for water? Will you start a conversation with your family and friends? Will you become an advocate for change in your community? The choice is yours. Every little step brings us closer to a healthier world. Thanks for joining us on this deep dive. Keep exploring, keep questioning, and keep making those healthy choices.
A shout out to our many listeners in Gibsons, Sechelt, Melbourne, Helsinki, New Orleans, Vancouver, Singapore, Copenhagen, and Sydney. We see you. Thank you for subscribing, following, commenting, and supporting our podcast. Find related articles at Heliox Podcasts on Substack. Thanks for listening today. 4 recurring narratives underlie every episode: boundary dissolution, adaptive complexity, embodied knowledge, and quantum-like uncertainty. These aren't just philosophical musings, but frameworks for understanding our modern world. We hope you continue exploring our other podcasts, responding to the content, and checking out our related articles at helioxpodcast.substack.com.